हेलो गाइस, वेलकम। तो आज है हमारा आपका टॉपिक जो है लीवर फंक्शन टेस्ट, एंड दिस इज़ वेरी हाई यील्ड टॉपिक। व्हाई ही इट इज़ हाई यील्ड? बिकॉज ये सिर्फ एग्ज़ाम के लिए हाई यील्ड नहीं है। बेसिकली ये नॉर्मल अगर डेली लाइफ का पूछा जाए तो उसमें भी ये बहुत इंपॉर्टेंट है। फॉर एग्जाम्पल, अगर हमने किसी को ब्लड टेस्ट के लिए कहते हैं, सीबीसी कहते हैं, तो साथ में सीबीसी के साथ हम उसको एलएफटी का भी कहते हैं। तो इसीलिए इन डेली लाइफ और फॉर मेडिकल एग्जामिनेशन ऑल्सो एलएफटी को जानना बहुत इंपॉर्टेंट है। तो आज हम स्टार्ट करते हैं एलएफटी का, जो कि एक बहुत ही ज़्यादा एक कोर कॉन्सेप्ट है। तो कैसे हम देखेंगे एलएफटी, और एलएफटी देख के हम कैसे बता सकते हैं कि ये लीवर सेल इंजरी है, या फिर ये बाइल ऑब्स्ट्रक्शन फ्लो है, या फिर ये लीवर का फंक्शन कैपेसिटी है, और इट इज और लीवर फेलियर है। ओके, सो बाय सीइंग एलएफटी वी कैन डिफरेंशिएट ऑल दिस थिंग्स। तो फर्स्ट, अगर लीवर सेल में हेपेटोसेलुलरी इंजर हो रहा है, हेपेटोसेलुलर इंजरी हो रही है, तो हम इसमें क्या देखते हैं? इसमें एएलटी बड़ा होगा और एएसटी बड़ा होगा। ठीक है, सो मोर एएलटी एंड मोर एएसटी। Why it is high? Because due to the hepatocytes damage, so एंजाइम लीक हो जाते हैं, तो एंजाइम लीक होने की वजह से ALT और AST बढ़ेंगे। तो इन CBC अगर आप देख रहे हैं कि ALT AST बढ़ा हुआ है, तो इसका मतलब ये हेपेटोसेलुलर इंजरी है। अगर फॉर एग्जाम्पल ALT इज ग्रेटर देन द टिपिकल लिवर इंजरी, इफ इट इज AST इज मोर देन इट इज एल्कोहलिक लिवर डिसीज। एंड व्हाई इट इज in alcoholic the AST is more? Because AST is found in mitochondria, and if more alcohol, then it cause damage to the mitochondria also, and mitochondria is also found in muscles. So that's why AST is more than ALT in alcoholic liver disease. But normally ALT is more than AST in typical liver injury. Okay, and so next is cholestasis. How can we differentiate cholestasis from that liver injury? It's basically we can see the marker ALP and GGT. Okay, if ALP is more and GGT is more, then we can think about the obstruction. Okay, so there is a clinical trick. We can see that if ALP is alone high, then it could be bone. But if ALP plus GGT is high, both are the high, then we can say this is the liver is, there is problem in the liver, or there is liver cholestasis, there is an obstruction in the liver. Okay, so here we can, for now we have understand between the hepatocellular injury and cholestasis. And the next is the liver function parameter. So liver function parameter, how can we diagnose this? By seeing the bilirubin, albumin and PT or INR. If there is bilirubin is high, then we can see the excretion function is albumin, then there is a problem with protein synthesis, and PT or INR, then we can say there is problem with the clotting factors. Okay, so if bilirubin is more, then it's jaundice. If albumin is less, then it's called chronic liver disease, and if PT is high, then we can say it's severe dysfunction of the liver. PT is prothrombin time. Okay, prothrombin time, which is the time for the coagulation formation, for the coagulation. Okay, so in short, this is your main thing. If AST and ALT both are high, then it is hepatitis, or we can say there is liver injury. If ALP and GGT both are high, then we can see there is obstructive jaundice, and if bilirubin and PT is, then it's called liver failure. Okay, and rather than, I also give you some extra things, such like if ALT is this, as we see here, if AST is more than ALT, then it is alcoholic liver disease. Okay, and how can we, in simple word, if we have to memorize this thing, so there is a simple trick. You can say that, for example, just think liver is a factory. Okay, if there is damage in the factory, then AST and ALT leak. If there is blockage in the factory, then ALP and GGTs rise. If there is failure of the factory didn't come, didn't work, then it is bilirubin, PT, albumin is affected. So thank you for today's video. I think this video is enough to solve 80% MCQ easily, because mainly students stuck in these type of questions because they are tricky. But if the concept is clear, we can now differentiate between liver injury and cholestasis and liver failure. So just don't memorize values, understand the patterns, and you're sure you will solve the mostly MCQ. So that's all today, and thank you. I hope you get this video and it will be helpful for you. Thank you so much. Bye bye.